Hey you guys, welcome back to another Miseducated Rambler video. My name is Pulani Dube, but YouTube prefers to call me Miseducated Rambler. Welcome back to another one of the Myths versus Facts series. So today we are going to be debunking all the misconceptions that have to do with fibroids, whatever people have come to believe about fibroids. Today we are straightening it out and we're setting the record straight. Okay, so the first statement is that fibroids are cancer. That is a myth because we already know that fibroids are benign tumors, meaning they are non-cancerous and they cannot develop into cancer. They cannot change or metaform into cancer, okay? There is a condition, however, that can be confused with fibroids. It's called leiomyosarcoma, and it's an entirely different condition, and it's not thought that fibroids arise, that the condition arises from fibroids. The second statement says that every woman with fibroids needs surgery. That's a myth because we already know that there are plenty of women living with fibroids, and these fibroids are not debilitating. They're not experiencing any symptoms that would require any form of treatment. There are women that go to live with them and never having to go through any form of treatment, like I said, okay? So that is a myth. Not every fibroid requires surgery. And then the third statement says that fibroids always cause infertility. That's a myth. It's not always the case that fibroids will cause infertility. The only time when fibroids are causing a problem is when they are blocking your fallopian tubes or they are disrupting the uterine lining, right? Which is what the embryo requires to be implanted onto, right? So if the fibroids are small and they're located far away from the uterine lining, they're not blocking the fallopian tubes, then you're good. There are many women that have managed to get pregnant, have safe pregnancies and deliveries with no problems. So that is a myth. Not every fibroid means infertility. Not every fibroid causes infertility. The fourth statement says that fibroids are only found in older women. So only older women get fibroids. That's a myth. Fibroids occur during your reproductive age, right? So people that are within the ages of in their 20s and 30s can be found with fibroids. So it's not just the 40s, the 40-year-olds, and the 50-year-olds. 20s and 30s, you can find that someone has fibroids. The fifth and final statement says that if your periods are heavy, it must be fibroids. That is a big myth. We know that there could be many contributing factors to why you're having heavy menstrual bleeding. It could be endometriosis, hormonal changes, bleeding disorders, endometrial polyps. There are many reasons, many conditions that could lead to you having heavy menstrual bleeding. Okay, so that's why it's very important that you go to your doctor and find out what it is. So it is a myth that having heavy menstrual bleeding must mean that you have fibroids. Okay, that is it for the facts versus myths episode. I hope you enjoyed it and you learned something new. If there are any other things that you might believe about fibroids, you can drop them down in the comment section and I will debunk them or support them. Just set the record straight, right? That's what we're here to do. So thank you so much for watching this video till the end. Until next time, bye.